Donna and I realized that neonates, as well as children who are ventilator dependent, need a cohesive team of nurses as well as therapists. In the Pediatric Pavilion, each house has its own set of nurses and, again, a therapist assigned. In this way, the nurses and the therapists collaborate with the physicians and parents to progress their care. It's consistent. Everyone knows who's on, who's taking care of who, what day, similar to in the hospital setting. And that is why our kids, we feel, have great outcomes in terms of getting home sooner and safer to their environment. Parents feel secure. They know what their home care setting is going to look like.
Our respiratory therapy team each has their own set of clients. After discharge, these respiratory therapists follow up with these clients, whether it be monthly or quarterly. They follow with them after doctor's appointments. We often get setting changes or modifications. Children get weaned off their oxygen, or they have setting changes to their pulse ox and apnea monitors. The respiratory therapist will then go out, assess these children directly, and make those changes as needed on the equipment. Nothing makes us happier than getting these kids off their ventilators and off their oxygen. And to help with that process, that's why it's so important for these RTs to be making those monthly and quarterly visits, so that we can communicate with the doctor's offices and let them know when these patients are ready. We analyze some of our apnea monitor downloads, and we send those directly to the physicians before appointments so that they can also make those determinations as well.
Our team, including our RTs, our nurses, along with our driver, Kevin, take our Pediatric Pavilion van, transport van, to the children's appointments outside our group homes. Every 60 days, the child's PCP can round and do round at our pavilions, as well as a pediatric intensivist. All of the needs, such as immunizations, ongoing formula changes unless specified by their GI physician, are evaluated and changed. And so we have a continuity of care.
In my 7 years as working as a pediatric ICU nurse, I had a little concept of what happened after we discharged these clients home. We would see our frequent flyers return to the ICU, and they would always have their home vents or maybe a suction machine. But after they got home, I didn't have a real appreciation or understanding of what really would occur in the home setting. It wasn't until I came to work for Children's Home Medical Equipment that my eyes were really open to what happens after we get these kids ready for discharge. One of our director of nursing, Ellen, took me on a little tour because they kept using words like Pediatric Pavilion, and I had no idea what they were talking about. I really had this conception that it was like a SNF unit or maybe like a long-term care facility. I had no idea that they were actually residential homes with bedrooms, with decals on the walls and colored curtains, and it looks like an everyday home that you would see next door. You just have no idea that there could be 6 ventilated children in that home. The only indication that there's an oxygen sign on the front door. I was absolutely amazed that they could maintain the level of care we offer in a hospital in a home care setting. And I never would have known unless I went and did the visit myself.
Hi, my name's Lori English. I've been here at Children First for 19 years. One of our stories is the story of Zaire Salazar, a patient that came to me when he was discharged from NEO about 5 years ago. He was a 24-week preemie twin that came to us on a ventilator, completely dependent on the ventilator and G-tube feedings, not very stable, and over the course of the past 5 years, we have gradually weaned him off the ventilator. He's on it only at night now. He goes to PPAC during the day. He's eating by mouth, and he's up and walking and moving around the pavilion and the PPAC, and his parents come and visit him whenever they get a chance and participate in his care. The pediatric pavilions are places where people can place their children to get care when they are lots of times too unstable to go home, and or if their parents aren't comfortable with their care. So we provide 24/7 care there by nursing staff. Parents have complete access to the homes. They can participate in the children's care. We welcome that and encourage them to participate in their children's care. And hopefully, once they do that, at some point we'll be able to reunify them with their families. the story of Nevaeh Sigleric. She's a patient that came to us from Arnold Palmer Hospital as well. Her grandfather has become very involved with her. He has visited every single day since she was placed in the pavilion years ago. He provides her care for several hours in the afternoon with the nurses, collaboratively with the nurses. He attends all of her doctor's appointments, and he also calls me as the case manager if he has any concerns or anything that he wants specifically addressed if he's not able to attend a doctor's appointment.
You expect to see beds like in a hospital, just lined up everywhere, which it's not. It's like my home, basically. It's just very similar. Furniture, everything, it looks normal, like a normal house. But you have, a crib. If a child's a small child, it's in a crib or, a hospital type bed. And you have the equipment, so it's just like a residential home. And then when they told me they were going to send her, first it was going to be foster care. I'm like, she's not foster care material, she needs round-the-clock care. And then they said, well, we'll bring in parents, we'll train them for, a week. And then I'm like, no, that's not going to do it either, So I had gotten involved in, from the get-go. And then they said, Pediatric Pavilion, and it would be a residential setting. I never knew something like this had existed before that. She gets awesome care. I mean, the nurses aren't just regular nurses, they're all dedicated, and it's a calling. Because the children that come here, they need round-the-clock care, and most people can't do that. They have to work. Life goes on, you got bills to pay. If you didn't pay the mortgage, there wouldn't be a house to have the child in anyway. So they need to get a look at the home and be able to see, meet the nurses, talk to the nurses, get a feel for it. Yeah, it's any new family that's looking for an alternative placement for a child, this is definitely the place. I mean, Children's First, they have nurses that are just go above and beyond, and they definitely need to come to the home, see the home, be able to make an appointment so that you can get in, because the door is always locked. Anybody can just show up and come in. And talk to the nurses that are on duty those days and walk around, look around, look at the children in the room and the care that they get. It's just an excellent alternative.
Having transitioned from the ICU setting to home care, I feel very strongly that the pediatric pavilions really feel a need in the community. They bridge the gap between the ICUs and home care and provide an opportunity for children to be discharged from the ICUs that aren't quite ready.